Yes, guys, after the dentition, we'll be discussing about examination of fetus. Examination of fetus. See, there are a lot of changes are there occurring with each month. It is what we'll be discussing is what is more relevant for examination and what is revisable for examination. Okay, so we'll discuss only about those important points. Fetus examination. Fine, let's talk about that. At the age of 1 month, we are talking about intrauterine life, right? Fetus, intrauterine life. 1 month. What we can see is we can see the eye spots, right? The developing eye spots will be there. Okay, 2 months. At the age of 2 months of intrauterine life, we can see the appearance of the limb buds. Limb buds. Okay, limb buds. 3 months. What we can see is 3 months we can see the nails getting appeared. Appearance of nails. Nails appear. Okay, nails appear at 3 months of intrauterine life. 4 months. We can see the appearance of lanugo hair. Right, we can see the appearance of lanugo hair. Right, and this is the time at the end of 4th month we can also see the sex differentiation. Right, sex differentiation can be appreciated. Right, determination of sex can be done. Okay, 5 months. That is when you can see the appearance of scalp hair. Scalp hair. Scalp hair. 6 months. 6 months we can see the eyebrows and eyelashes, they appear. Eyebrows and eyelashes, they appear. After the appearance of eyebrows and eyelashes, the eyes will open. Right, opening of eyes. Eyes open. Right, eyes open. 8 months. At the age of 8 months of intrauterine life, the left testis will be there in the scrotum. Left testis will come to the scrotum. It will descend to the scrotum. Right, 9 months. You can see the right testis will also descend to the scrotum. Descend to the scrotum. So by the age of 9 months, both the testes will be in the scrotum. Okay. These are the features that you can see at different months of intrauterine life. After this fetal examination features, then we need to discuss about one more very, very important area, that is age estimation from ossification centers. Nowadays, it will become very, very important that you get lot of questions in different examination, either it NEET PG or FMGE or INICET examination, that this kind of age estimation from ossification centers is highly important, that you get lot of questions frequently. Many a times students find it very difficult to answer this, be it UG university examination or if it is NEET PG or INICET examination, maybe for next examination. See, people find it very difficult. So what we can do it, we'll try to have a detailed discussion of this particular topic so that you will find it you'll understand it better and you will find it easier to answer in the examination, right? I told you that we can find out the age of the person by different means. One by dentition, another one important one is ossification center. So let's start with the basic rules. What are the basic rules? Fine. See, any bone, any long bone will have got primary ossification centers and they've got secondary ossification centers. First, what you have to know is the ossification is basically, right, you have a lot of centers. You have in a long bone, you have primary ossification center. You also have secondary ossification center. The secondary ossification center will grow. It'll appear. It'll grow. It'll fuse with the primary ossification center. What happens? You have basically 450 ossification centers that fuse with each other to become 206 bones. 206 bones. Okay, 206 bones. Right, if you talk about long bone, let us assume that this is the long bone, right? Let us say this is the primary ossification center which is forming the shaft of the bone. Maybe we can say that is diaphysis, and you will have one more, that is secondary ossification center, right? Let us say this is secondary ossification center. This secondary ossification center will be forming epiphysis of the long bone. right? Assuming that it is the epiphysis of the long bone, secondary ossification center. See, this secondary ossification center will have one specific age for appearance, right? And at a particular age, it will fuse with the shaft of the long bone, right? At the end of the fusion, what happens is you can see the whole long bone completely fused. Epiphysis will be fusing with the diaphysis. There is one age for the appearance of secondary ossification center. There is one more age that is for the fusion of ossification center to the shaft of the bone, right? You need to know that age, right? And you just have to read the X-ray whether the secondary centers has appeared or not. If it has appeared, whether it is fused or not. So it is as simple as that. We need to learn the ages, and we should also be able to find out whether the secondary center has appeared or not in the X-ray, or if it has appeared, whether it is fused or not, right? Only 2 steps we have got, and we are going to learn that ossification age estimation. Right, as I told you, every ossification center has got specific age of appearance and fusion. We are going to learn that, and we are going to apply it. As simple as that, right? And do remember, see, the age of appearance and the age of fusion, it has got a lot of variations in different textbooks. Basically, that is because of the different references they have quoted. Right, I am just taking the reference, the age ranges that is given in Dr. Narayan Reddy, K.S. Narayan Reddy, Essentials of Forensic Medicine and Toxicology. Right, so I am just taking Narayan Reddy textbook. If you see the males and females, the fusion of epiphysis will be 1 year earlier in case of female when compared to males. 1 year, the fusion will be little earlier than the males, right? And the entire fusion process, whether it is male or female, the entire fusion process, it's a process, it's not an event, right? Slowly it happens. It's a process. It starts in the center and it progresses periphery. Starts in the center and it progresses peripherally. We'll be discussing each and everything about that. To start with, let us start about the ossification centers that you see in the fetus, right? 5 months of intrauterine life, we get the center for calcaneum, right? 5 months. The first ossification center for the bone, that is clavicle, that you know, right? The first center is clavicle. We are talking about the other centers, right? So here 5 months it is calcaneum, 7 months it is talus, right? 9 months, that is 36 weeks of intrauterine life. Here is where you get the lower end of femur, right? Not the upper end of femur, guys. It is lower end of femur, right? And it is 38 weeks of intrauterine life. We can say near term or near birth. What you get is the upper end of tibia. So basically, around the knee joint, you get lower end of femur and upper end of tibia just at the time of birth. And at the time of birth, you get one more important bone for that is cuboid. So basically, you've got these are the 5 important centers that appears at different age. You can also remember C, T, F, T, C. Okay, it's a palindrome. Fine. C for calcaneum, talus, femur, tibia, and cuboid. Right? If you reverse it, it will also be the same. Fine. Now moving on to the one more important bone, that is your sternum. Let's talk about sternum. Sternum, basically, you know there are 3 parts of sternum. One is the manubrium, another one is the body, another one is xiphoid process. If you see manubrium, let us say this is manubrium. Okay. And it appears around 5 months of intrauterine life. Then the body of sternum does not appear from a single center. The body of sternum appears from 4 different centers. 4 different ossification center. You can say this is 1, this is 2, this is 3, and this is 4. Right? How to remember the appearance of age? Everything is in intrauterine life. You can see it is 5, 7, 10. Right? You can see 5, 5, 7, 10. First 5 for manubrium, 5, 7, 7, 10. That is for body of sternum. Then the last one, you have got xiphoid process. right? Xiphoid process will be appearing at the age of 3 years, right? Fine. Now, as I told you, the body of sternum does not appear as a single bone, so it has to become a single bone by fusion process, right? Let's talk about fusion process. How does it fuse? You can see that the fusion starts from down to up, gradually, right? This area will get fused, this area will get fused, this area will also get fused. Okay, you can say this is 15 years, 20 years, 25 years. What you can remember is, right, instead of remembering each and every joint, you can remember the body of sternum becomes a single bone at the age of 25 years. That's what you need to remember, right? The body of sternum becomes a single bone at the age of 25 years. That is important for examination purpose. Okay, and the xiphoid area, this area will get fused at the age of 40, and this is old age. All this is not so important. What you have to remember is the body of sternum. The fusion of body of sternum is important. You need to remember that it starts from down upwards, and it becomes single bone at the age of 25. That is most important for examination purpose. Okay, let's talk about sacrum. The 5 sacral vertebra. You know, there are 5 sacral vertebra. All the 5 sacral vertebra will fuse with each other. You can see a single sacrum, right? The whole bone, whole sacrum, right? 21, or you can say 22 to 25 years. That means by the age of 25 years, again the sacrum becomes a single bone. It fuse becomes a single bone. You remember sternum, that also where I told you 25 years, body of sternum 25 years, yes, sacrum also 25 years, easy to remember. Okay. You talk about mandible. Mandible, you have two, developmentally you can see there are 2 halves of mandible. It has to fuse with each other to form a single mandible, right? The 2 halves of the mandible, it fuse to become a single mandible at the age of 2 years. How to remember? You can remember 2 halves, 2 years, 2 and 2. Okay, 2 and 2. That is mandible. Let's talk about the other bones. First one, or we'll talk about the joint. Let's start with the joint. So to start with, let us start with the most important joint, that is shoulder joint. Let's start with the shoulder joint, right? While starting with the shoulder joint, first I would like to mention the parts of the bone that we are going to see in the X-ray. Then I'll be telling you the age. If you see, this is the shoulder joint. You can see that this is the upper end of humerus. There is one center for the head of humerus. There is one center for the greater tubercle. There is one center for the lesser tubercle, right? So you have got one center for the head of humerus, one center for the greater tubercle, another center for the lesser tubercle. All these things will fuse together. Then it will fuse with the shaft of the long bone, shaft of the humerus. So this is how it is going to happen. And in the X-ray of the shoulder, we will also be looking at the tip of the acromion process, right? So there is one center for the tip of acromion process that we'll be learning that as well. Fine, right? Now, so I've told you the important places where we have to look in the X-ray. Now let me tell you what are the ages. The head of humerus, it appears at 1 year of age. The greater tubercle 3 years. The lesser tubercle, it is 5 years. You can remember odd numbers 1, 3, 5, right? 1, 3, 5. All these centers will fuse with a shaft around 18 years. Fine, 18 years. The tip of acromion process, you can see it appears at 14 to 15 years. It fuses at 17 to 18 years. 14 to 15 and 17 to 18. Fine. So let me show you how the appearance and fusion happens. Let us say this is the head of humerus. Let us say this is the head of humerus. It appears at 1 year of age, right? 1 year. And then what happens? You can see the greater tubercle. There is a center for the greater tubercle, that is 3 years. And then you have got center for the lesser tubercle, that is 5 years. Fine. And you can see this is the shaft of the humerus, right? Now you can see 3 centers have appeared. Head of humerus has appeared, so 1 year. You can see the greater tubercle has appeared, that is 3 years, and lesser tubercle has appeared, that is 5 years. But it has not fused with the shaft, because you can see there is a gap here, so it has not fused with the shaft. Fine. So you can see I told you the normally the head of humerus, greater tubercle, lesser tubercle, it fused with shaft at the age of 18 years. right? Now you can see here all the three centers have appeared for the upper end of humerus, but it is not fused with the shaft of the humerus, right? So this is the observation. Now what happens after some time, you can see all the three centers, they fuse together. All the three centers, that is head of humerus, greater tubercle, lesser tubercle, they fuse together to form a conjoint epiphysis. They fuse together to form a single bone, right? You can say that can be seen around 5 years. And when does this mass fuse with the shaft of the humerus? This mass will fuse with the shaft of the humerus at the age of 18 years, right? At the age of 18 years. So when you are able to see the fused, right? When the head of humerus fuse with the shaft, you can say the person must be minimum 18 years, right? Normally it fuses around 18 to 19 years. So when it is fused, you can say it is 18 years. Once it is completely fused, you will see something like this, right? You can see, right? You can see greater tubercle, right? And you can see the shaft which is complete. Shaft which is complete. You can also see the lesser tubercle, right? You will find something like this. In this X-ray, you can see that upper end of humerus has completely fused with the shaft. You can see that, right? There is no gap here. So you can say the person must be minimum 18 years of age, right? So okay, you can easily identify the person must be minimum 18 years. Now, as I told you, you can see the tip of acromion process. If this happens to be the acromion process, in the tip you can see the tip of acromion process, appearance is 14 to 15. It fuses with the main acromion process. Tip fuses with the acromion process at the age of 17 to 18. So now you can see here, it is completely fused here, right? So you can say the person must be minimum 18 years. Again, you can say the person must be minimum 18 because again, you can look at the upper end of humerus. Let's look at the few other X-rays, right? You can see here, right? You can see upper end of humerus, it is not completely fused yet because you're able to see a gap. Right, it is not completely fused. You can see it is maybe in the middle, in the center, it has started fusing. Normally what happens, the fusion starts in the center, it gradually extends periphery, right, to the periphery. Fine, it starts in the center, it spreads to the periphery. Right, maybe now it is the process of fusion now happening, you can see, but it is not, one thing that you can easily notice is, it is not completely fused. It is not completely fused. Let me show you another X-ray. Right here you can see the medial end of clavicle. You need to look at the medial end of clavicle. I'll show you the medial end of clavicle. You can see that the medial end of clavicle. So this is the medial end of clavicle. See, clavicle is one very abnormal bone, right? So very special bone. You can say very special bone or unique bone. It has got lot of uniqueness, right? Normally the long bones will have epiphysis, secondary ossification center on either ends. But this long bone, it is horizontally placed long bone. It has got the secondary ossification center only at the medial end, right? It has got secondary ossification center only at the medial end, which appears around, right? Which appears around 18 to 19 years. It appears around 18 to 19 years, whereas the fusion is 18 to 19 years, whereas the fusion is, it is 21 to 22 years, right? You can see now it has appeared, but it is not fused. You can see the similar X-ray here. You can see this medial end of clavicle, you cannot see the center cannot be seen as a big mass, not like that. One simple vertical strip will be noted, something like this. I hope you are able to appreciate this. I hope you are able to appreciate this side as well. You can see a small strip of secondary ossification center that has appeared but not fused. You can see it has appeared but not fused. As it has appeared, you can say the minimum age of the person is 18. As it is not fused, with this point, you can say the person must be below 22 years. Right? It has appeared, so minimum it is 18 years. It is not fused. The person has to be less than 22 years with this finding. You can see this finding, you can say it has appeared but not fused. If it is completely fused, you will see something like this. You see it's completely fused. Right? You can see that it is completely fused. You can definitely say the person, here also you are able to see that there is one center which has appeared but it is not fused. Right? Fine. So you can see this is the medial end of clavicle. Fine. So you are able to learn two important things. One is upper end of humerus, that is shoulder joint. Another one is medial end of clavicle. We have just learnt about two important points. This medial end of clavicle was asked even in your last year INA-CT examination, at what age that it fuses. Remember, it fuses around 21 to 22 years. 21 to 22 years. Fine. So we have covered the shoulder joint along with the medial end of clavicle. Now we'll be moving on to another important joint, that is your elbow joint. We'll discuss about elbow joint. But do remember, when you're talking about elbow joint, we are going to learn about 6 centers. Right? See, elbow joint is made up of 3 bones, right? What are the 3 bones? You can see it is the lower end of humerus, you can see upper end of ulna and upper end of radius. 3 bones are there around the elbow joint, and there are 6 centers that we're going to learn here. What are the 6 centers? I'll tell you. See, first of all, when you see the X-ray, find out which is the medial side, which is the lateral side. That is most important, right? So this happens to be the lateral side because you have got radius, and this happens to the medial side because you have got ulna. Right, now I'll tell you there are 4 centers in the lower end of humerus. What are the 4 centers? You can see that this is medial epicondyle, or you can say inner epicondyle. Inner epicondyle, right? You can see this happens to be trochlea, right? This happens to be trochlea. This happens to be capitulum. This happens to be capitulum, right? And here is where you will have lateral epicondyle, also called as external epicondyle. There are 4 centers in the lower end of humerus. You can see medial epicondyle, you can see this is trochlea, you can see capitulum, and you have also got lateral epicondyle. Fine. Now look at the ulna and the radius. For radius, there is one center that is for the head of radius. There is one center that is for the head of radius, and for the upper end of ulna. See, this is AP view. For the upper end of ulna, see the tip of ulna, you have what is called as olecranon process. For the olecranon process, there is one tip of olecranon process that appears as a separate secondary ossification center. That may not be so visible in AP view, but when you take lateral view, I'll be able to show you that it is a tip of olecranon process. So basically, we have got 6 centers. I repeat, we have got medial epicondyle, we have got lateral epicondyle, we have got capitulum, we have got trochlea. Right, and tip of olecranon process, and we have head of radius. So we have all these things in the elbow joint. Now let me tell you how to remember the 6 centers. They can ask you what is the chronological sequence of the appearance in the centers around elbow joint. What is the sequence? What is the chronological sequence? We're going to learn that. Right. See, what you can remember is you can remember what is called as crito. Right, crito. What is crito? That is a mnemonic which will tell you the sequence of the ossification center appearance in the elbow joint. What is that? What? C for capitulum, right? C for capitulum, right? It's not capitate. Capitate is the carpal bone that we're going to learn in the wrist joint. This is capitulum, right? And then we have radial head, head of radius. We have radial head. Right, and we have inner epicondyle. I told you inner epicondyle is otherwise basically medial epicondyle. Right, T for trochlea. Olecranon process, I told you that is tip of olecranon process. And finally, what have you got? You have got external epicondyle, also called as lateral epicondyle. Right, so remember, this is the sequence that you have to remember. When you know the sequence, you will obviously remember what are the ages of each center. Right. Now, let me tell you, capitulum. Capitulum appears around 1 year. Right? Radial head, 5 years. 1 plus 5 is 6. 6 years. Reverse is 6. You get 9 and 9. 9 years, 9 years. Finally, you get 11 years. 1, 5. 1 plus 5 is 6. And you reverse is 6. 9, 9. Finally, you get 11 years. So, these are all the age for appearance of all these centers. Right? I've told you appearance. Let me tell you how can you see the fusion. Right, let us say this is the lower end of humerus. Right, let us say this is the lower end of humerus. Fine, and you have got radius, right, and you have got ulna. Right, this is your ulna. Fine. Now, when you look at the lower end of humerus, I told you the first center to appear is a capitulum. You can see capitulum will appear here, first center. Right. Then you have got radial head. You can see the head of radius here. Fine. Right. Let me use another color so that you'll be able to differentiate. This is head of radius. Right. Then you have got inner epicondyle. Where have you got inner epicondyle? For that you need to know which is the medial side. This is inner epicondyle, medial epicondyle. Then we have got trochlea. Right. Then we have got trochlea. Right, I've told you, I've shown you 3 centers in the lower end of humerus so far. Right, what are they? I told you capitulum, right, head of radius I've shown you. Then you've got medial epicondyle, right, and then I have shown you trochlea. The next center, that is tip of olecranon process, let us imagine that it appears in the back. Right? When you extend your elbow, it can be seen in the back. The last center to appear, what is the last center to appear? The last center to appear is external epicondyle, also called as lateral epicondyle. Let us say this is the lateral epicondyle. Right? Now you can see all the 6 centers have appeared. Now how does it fuse? You need to remember, you see the center for the medial epicondyle, the trochlea and the capitulum, they fuse together to form a conjoint epiphysis. All these 3 centers, they fuse together to form a single bone. We call it as conjoint epiphysis. This happens around 14 to 15 years. This happens around 14 to 15 years. Then it fuses with the shaft of humerus. Then it fuses with the shaft of humerus like this. Right? And the lateral epicondyle that is separate, that fuses with the shaft of humerus separately like this. Fine? Right? The lateral epicondyle does not participate in the conjoint epiphysis formation. Only the medial epicondyle, trochlea, capitulum, they fuse together, then it directly fuses with the shaft. Lateral epicondyle, it separately fuses with the shaft. So when all these things fuses, you can say that is around 16 years. 16 to 17, on an average you can remember it is 16. Likewise, you can see the head of radius fuses with the radius, 16 years. The tip of olecranon process fuses with the olecranon process, 16 years. So when you can see the complete elbow like this, you can say definitely the person is around 16 years. Right? You can say the person is around 16 years. I have told you all the ages, 1, 5, 6, 9, 9, 11. Right? All these centers will fuse. When the fusion is complete, you can say it is 16. It is 16 to 17. You can remember 16 for remembrance purpose. Right? Let me show you few x-rays so that you'll be able to find it out. Again, you can see, right? Find out always which is medial, which is lateral. So this is your lateral side, this is medial side. Right? You can see this is your head of radius, which is completely fused. Right? You can see the lower end of humerus, it is completely fused. All the centers, all the 4 centers are fused with the shaft. You can definitely say the person is around 16. Now see here, this is another important x-ray where I have given you an x-ray which is not fused so that you'll be able to understand. First, let's finish off lateral view. In the lateral view, I told you tip of olecranon process. You can see it is seen only in the tip of olecranon process, and AP view it is difficult to find out. You will be able to find out in this area, but it's quite difficult to find out. No problem. You can remember it is seen in the lateral view. Fine. Now look at the other centers. What are the other centers? Let's go with the flow. What is the first center to appear? I told you the first center to appear is capitulum. Next center, radial head. Appeared but not fused. What is the next center? Medial epicondyle. You can see the medial epicondyle appeared, not fused. Appeared, not fused. Right? What is the next center? Trochlea. You can see it has appeared but not fused. What is the next center? You have got olecranon process that has appeared, not fused. And finally, you have got lateral epicondyle appeared, not fused. You can see all the centers have appeared but not fused with the shaft. You can say that the person is above 11 years. With this, all the centers appeared. You can say the person is above 11 years but it has not fused. Right? So less than 16 years. You can say the person is around 11 to 16 years. Right? The person should be around 11 to 16. I have not taken the conjoint epiphysis into consideration. For easier purpose, you remember all the centers have appeared but not fused. So easy to find out. Okay. Again, you can see another joint. It is completely fused. The person must be about 16 years. Right? So this is elbow joint. Now the next joint is your wrist joint. Wrist joint is something which is very, very frequently asked, and you need to know in detail about the wrist joint because we'll be learning about the carpal bones. Not only carpal bones, we'll also be learning about the lower end of radius and the lower end of ulna. Right? Don't make mistake in finding out which is ulna, which is radius. Right? What you are looking at is the radial styloid process. This is radius, and this medial side, this is ulna. Fine. So you can't afford to make basic mistakes like that. Fine. So that's why I always tell you, always find out which is the medial side and which is the lateral side. Now let's go forward. Right? I told you in the wrist x-ray joint, if you are giving you an x-ray of wrist joint, we'll have to observe the carpal bones. We will also be seeing the lower end of radius and lower end of ulna. Sometimes we'll also be looking at the base of first metacarpal. So let us have a discussion on that. First of all, as I told you earlier, when you are looking at X-ray, you need to identify each bone. right? So lower end of radius is quite simple. We have identified. Lower end of ulna we have identified. No problem. What about the carpal bones? So we'll have to learn about carpal bones. First of all, you need to tell me how many carpal bones we have got. How many carpal bones we have got? Yes, we have got 8 carpal bones. So what are the 8 carpal bones? Can you name the 8 carpal bones? Yeah, that is the easiest question that I ask you, right? You can easily say this is scaphoid, this is lunate, triquetral, you can say this triquetral, this is pisiform. Pisiform is a spherical bone, right? And then you've got trapezium, trapezoid, capitate, hamate. These are the 8 carpal bone that we have got. Do remember, when you are starting the scaphoid, always do start on the lateral side, right? It has to come from lateral to medial. So that is an easy way to, you can remember. You can't make any mistake on that. Scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate. But here what happens, you can't see these 8 bones separately, right? Pisiform is normally superimposed on the triquetral, right? You will also be finding trapezium on the trapezoid. Fine. So these are the superimposed bone that you can see on the X-ray. You just have to find out, right? Fine. These are all the 8 carpal bones we have got. And you know the mnemonic very, very well, right? She looks too pretty, try to catch her. So this is the first mnemonic that you always remember from your anatomy days. Okay, fine. So let's go forward. I told you carpal bones, right? Scaphoid, lunate, triquetral, pisiform, lateral to medial, proximal row. Then trapezium, trapezoid, capitate, hamate, that is a distal row. Now let me tell you the appearance of all these 8 centers so that you can remember it better. See, which is the largest carpal bone? You need to know what is the largest carpal bone. Which is the largest carpal bone? That is capitate. You can remember captain, largest fellow, captain, right? The second one is hamate. So among all the 8 carpal bones, the first fellow to come is captain. Who's the captain? Capitate will be the first fellow to come, right? Captain will be the first fellow to come. You can say capitate, capitate, right? Appears around 2 months of age, right? After birth. We are not talking intrauterine life, we are talking after birth. Then we have got hamate, right? This is 3 months to 1 year. I told you first captain, then comes the second fellow, that is vice captain. You can say vice captain, capitate, hamate. Then we've got triquetral, right? Underline tri, that means it is 3, so you can remember 3 years, right? Then we have got lunate, right? Then we have got lunate. The first letter of lunate is L, so you can write L and make it 4. That is the easiest way you can remember the lunate, that is 4 years, right? Then you have got scaphoid, right? What is the first letter of scaphoid? That is S, so make it 5, that is 5 years, so easy to remember, right? Then you have got trapezium, trapezoid, the twin bones, trapezium and trapezoid, right? You can say 5 to 6 years, right? What is the last carpal bone to appear? The last carpal bone to appear is pisiform, right? Which is 9 to 12 years, right? So you can remember captain, vice captain, triquetral 3, lunate, scaphoid, trapezium, trapezoid, and the final bone is pisiform, 9 to 12 years. So if you are able to see all the 8 carpal bones, then you can say all the 8 carpal bones have appeared. The minimum age of the person must be 9 years, because 9 years, right? You can see, I told you lateral to medial. You can say this is scaphoid, this is lunate, this is triquetral. On the top of triquetral, you can see a circular shadow, that is your pisiform, right? So this is trapezium, trapezoid. You can see the captain, the biggest bone, and then you've got hamate. So from lateral to medial. So let us look at the other centers in the wrist joint. You can see the lower end of radius and lower end of ulna, right? The lower end of radius, it appears around 2 years, whereas lower end of ulna, it appears around 5 years, right? 5 years. But now what happens, right? The ulna will fuse first, 17 to 18 years, whereas the radius will fuse later, 18 to 19 years, 1 year difference. But what you have to observe is the center which appeared first will fuse later, right? Radius has appeared first, but it fusing later, that is rule of ossification, right? Now you can see base of first metacarpal, right? The base of first metacarpal, maybe it appears around 2 years, it fuses around 15 to 17 years, 15 to 17. right? So we have learned all the 8 carpal bones. We have learned the base of first metacarpal. We have learned about the lower end of radius and ulna. Now let us have a look at it. You can see the lower end of radius appeared unfused. Lower end of ulna appears unfused. All the 8 carpal bones have appeared. Base of first metacarpal appeared unfused. So the minimum age of the person must be 18 years. That is from your radius. That is the last change that has appeared, right? In this X-ray, you can see that I have taken the X-ray where some of the centers are not fused, right? So that is for you to understand it better, observe it carefully. And one more thing, when I was talking about carpal bones, I told you only appearance. There's only appearance for the carpal bone. There is no fusion for carpal bones. You have fusion for appearance and fusion for the lower end of radius and ulna, but there is no fusion of carpal bone. There is only appearance of the carpal bones. So don't think of fusion of carpal bone. That doesn't happen, right? So now look at this X-ray. You can see this is lateral side, this is medial side. You can see the pisiform has appeared. That means all the 8 carpal bones have appeared. No doubt about that. Now look at the remaining bones. You can see this is the lower end of radius appeared but not fused because you are able to see the joint space, right? You can see the small gap is there, right? The small gap is there. That means it is not fused. You can see this is the lower end of ulna, right, which has appeared but not fused. You are able to see a gap. That means fusion has not occurred yet. It is not fused, right? Don't think about this space. This is the joint space, right? We should not see the joint space. This is the space. What we are looking at is between the epiphysis and the primary ossification center, between the shaft and the epiphysis, right? This is secondary center, this is primary center. In between, you're able to see the gap, right? We are not supposed to see the joint space. Don't get confused with the joint space. Now look at this base of first metacarpal. The fusion has started, but it is not complete. It is not complete, right? You can see this is another X-ray wherein you can see this is the lateral side, this is medial side. Base of first metacarpal completely fused. You can see the pisiform, which is so clear. All the 8 bones have appeared. You can see lower end of ulna completely fused, lower end of radius also completely fused. The minimum age of the person must be 18 years of age, right? You can see this is another X-ray of a child. You can easily see that. You can see this is capitate, this is hamate, and this is triquetral. What about this bone? What about, don't think it is lunate. That is not lunate. Do remember, this is the lower end of radius. That's the lower end of radius. I told you, it appears around 2 years. This is lower end of radius. 3 carpal bones have appeared. So the minimum age of the person must be 3 years. Lunate has not appeared. So it should be less than 4 years, 3 to 4 years. Easy to find out. So the next X-ray that we'll have to discuss is X-ray pelvis. In X-ray pelvis, you can see this is your X-ray pelvis, wherein we'll be learning about the pelvis bone as such. In addition to that, here we'll also be learning about the upper end of femur. First, let me tell you what are the centers that we'll have to see in the X-ray pelvis, right? In the pelvic bone. The number one, iliac crest. Okay, iliac crest. This is the place of iliac crest where we have to look for. And then we have ischial tuberosity. This is the place of ischial tuberosity that we'll have to look for. Ischiopubic ramus. So this is pubic ramus. This is ischial ramus. So this place is where we have to see whether the ischiopubic ramus has fused or not. There will be a gap. During development, there will be a gap. Both are separate. Then as the person grows, this will grow together, right, towards each other, and it will fuse together, right? So that is ischiopubic ramus. Then triradiate cartilage. What is the triradiate cartilage? Triradiate cartilage, basically we'll have to examine the acetabular area. You can see we have to examine the acetabular area. If you are able to see a complete acetabulum, that means the triradial cartilage is obliterated. It is fused. It is calcified, right? Why we are talking about triradial cartilage? The acetabulum, when you see, this has got contributions from 3 important bones: ilium, ischium, and pubis, right? Acetabulum is basically made from 3 bones, contributions from 3 bones: ilium, ischium, pubis. Basically, this area, this particular area will be a cartilage. The fusion junction between these 3 bones will be a cartilage, and there will be a gap. Okay, during development, as the person grows, that cartilage becomes ossified. You are able to see a complete continuous bone like this, acetabulum. So we'll have to see that area also, right? Now when you look at this iliac crest, the normal age of appearance is 14 to 16. Everything is in years, right? Years. Ischial tuberosity, it is 16 years. Ischiopubic ramus, I told you there is no appearance, both are separate, only fusion will be there. We'll discuss about that. And triad cartilage is already a cartilage since birth, it has to ossify. Now I told you iliac crest, it appears 14 to 16 years, it fuses around 18 to 20 years, right? And this ischial tuberosity appearance is 16, the fusion is around 20 to 21 years. Ischiopubic ramus, I told you there is no appearance. The fusion will happen by 6 to 9 years. 6 to 9. Okay. You can see here it has already fused. It's continuous bone. When it's a continuous bone, you can say it is fused. Okay. Right. And triradiate cartilage. The ossification, the obliteration, it occurs around 13 to 15. Again, you can see it is continuous bone. It is continuous. That means obliteration has occurred. So 13 to 15. Okay, fine. Now we'll discuss about. So this is the point that we have to see in the pelvic bone. Now we'll be discussing about upper end of femur. In upper end of femur, when you look at this, there are three important centers are there. One is head of femur, greater trochanter and lesser trochanter. Head of femur, it is 1 year. Greater trochanter, it is 4 years. And lesser trochanter, it is 12 years. 12 to 14. You can remember 12 years. Okay, 1, 4, 12. 1, 4, 12. And everything will fuse with the respective shaft at the age of 17 to 18. Right? There is one point that you have to remember here. When we discussed about the upper end of humerus, I told you head of humerus, center for head of humerus, center for greater tubercle, center for lesser tubercle. All the three centers appear differently, but they fuse together. Then it will fuse with the shaft. But here it is femur. Here what happens? All the three centers, it appears and it will fuse with the shaft independently, separately. Right? This is greater trochanter. This is lesser trochanter. Right? And this is head. Head will appear. It will fuse with the shaft. Greater trochanter will appear. It will fuse with the shaft. Lesser trochanter will appear. That will fuse with the shaft. But all this fusion, it happens around 17 to 18 years. Right? So this is the point that you have to remember. Right? When you discuss about X-ray pelvis, we have to learn about we have to see the centers of pelvis. We should also see the centers of the femur as well. So we'll see that. In this X-ray, you can see the centers of pelvis and centers of the upper end of femur. You can see iliac crest has appeared and fused, ischial tuberosity appeared and fused, ischiopubic ramus also fused. And you can also note that the acetabulum is complete, right, without any gap. Okay, now coming to the upper end of femur, head is fused, greater trochanter is fused, lesser trochanter is fused. So the minimum age of the person is 20 years. Why should I say 20 years? The last center to fuse is ischial tuberosity. When I say ischial tuberosity, the normal age of fusion is 20 to 21 years. It has fused. It's a positive finding. So take the lower limit, that is 20. Okay, so the age of this X-ray is 20 years. Now this is another X-ray that we can look for. Here you can note that the iliac crest has not appeared. You can see it is irregular, right? It has not appeared. You can see acetabulum has not obliterated. Triradiate cartilage has not obliterated. The ischiopubic ramus has fused. Ischiopubic ramus has fused. And you can see here the ischial tuberosity has not appeared. Ischial tuberosity has not appeared. Head of femur has appeared. Greater trochanter has appeared. But the lesser trochanter has not appeared here. Lesser trochanter has not appeared. It is yet to appear. So that means the person is above 6 years. Why should I say 6 years? Because the ischiopubic ramus has fused, right? And then it is less than 12 years. That is because the lesser trochanter has not appeared. Lesser trochanter has not appeared. So that is very important. That is very, very important. Okay. Now let's go forward. This is another X-ray. But here the X-ray you are able to see only half of this bone, but still no problem. We'll look at the finding that are visible here. You can see iliac crest has appeared. You can clearly see the iliac crest has appeared, but not fused, right? You can see acetabulum is complete. Triradiate cartilage is obliterated. So what you can understand is, and you can also note that here the head of femur is fused. Head of femur is fused. From this, what we can understand is the person is above 17 years. Why 17 years? This area of fusion is normally 17 to 18 years. It has appeared, so we need to take the lower limit, that is 17 years. Iliac crest, the normal age of fusion is 18 to 20 years. It has not fused, So take the upper limit 20 years. The person must be 17 to 20 years. Right? 17 to 20. Whatever finding that are available with this X-ray. Okay. This is another X-ray pelvis. Right? Here you can see iliac crest has appeared but not fused. You can see it has not fused. Iliac crest has not fused. Ischiopubic ramus has fused. Acetabulum is complete. Triradiate cartilage is obliterated. Fine. And look at this ischial tuberosity. Can you see a small line at the ischial tuberosity? That means, see, normally the ischial tuberosity center will be looking like a very thin line that has appeared but not fused. You can see here it has appeared, but there is a gap in this side also. You are able to see that it is not fused. It is not fused. Okay. And but look at the femur. Head has fused. Greater trochanter has fused. You can see the typical lesser trochanter. The typical lesser trochanter has appeared and fused. So the person must be minimum 17 years. Why 17 years? Head of femur, greater trochanter, lesser trochanter has fused. The normal age is 17 to 18. It's a positive finding, it has fused. Take the lower limit, that is 17. Okay. Iliac crest has appeared but not fused. The normal age of fusion is 18 to 20 years. Since it does not fuse, it's a negative finding. Take the upper limit 20. So the person must be between 17 years to 20 years. Right? So that is the age group for this fellow. Ischial tuberosity, that is also not fused. But when the iliac crest is not fused, obviously ischial tuberosity would not have fused. Right? So that is 17 years to 20 years. This is another important X-ray wherein you are able to see one more additional finding. That additional finding is this triradiate cartilage. I hope you are able to see the gap in this. Okay, that means triradiate cartilage is not obliterated. Okay, triradiate cartilage is not obliterated. I kept this X-ray only for the purpose of showing you the non-obliteration of triradiate cartilage. Right, you're able to see a gap. So far, whatever X-ray that we have seen, it is completely obliterated. You can see a continuous acetabulum, right? This is here, it is not continuous. See, it is not obliterated. Okay, ischiopubic ramus has fused. Right, ischial tuberosity has not appeared. Iliac crest still it has not appeared. It has not appeared. Okay, you can see head of femur has appeared but not fused. Greater trochanter appeared but not fused. Right, lesser trochanter, this side you can see some kind of shadow appearance. Here you are not able to see that on the left side. Okay, sometimes what happens when they are taking X-ray, if the leg is little rotated, right, what happens is the lesser trochanter may not be visible. That you need to look carefully while you are interpreting the X-ray. Okay, so the point is very simple. You know what are the centers that you see. There are 4 centers that we see in the X-ray pelvis. There are 3 centers that we see in the upper end of femur. So totally 7 centers. You just see whether it has appeared or not, whether it fused or not. Based on that, you'll be able to find out the age of the person. Now coming to the knee joint. Right? Coming to the knee joint, here we are able to see this is a knee joint. The lower, this is femur bone, the lower end of femur bone. The lower end of femur bone appears 36th week of intrauterine life. Right, intrauterine life, whereas the fusion with the shaft is around 18 to 19 years. 18 to 19. Okay, similarly, when you look at the upper end of tibia, appearance is around 38 weeks of intrauterine life, or you can say it is near term, right, just at the time of birth, whereas the fusion is again 18 to 19 years. Fibula, upper end of fibula, appearance is 4 years, whereas the fusion is around the same age, 18 to 19 years. So that means that when the knee joint is completely fused, you can say the person is minimum 18. Okay, so you can see again, this is another knee joint wherein you can see the lower end of femur has appeared and fused, upper end of tibia has appeared and fused, fibula is also appeared and fused. Right, you can see again the same knee joint. You can see it has lower end of femur appeared and fused, upper end of tibia appeared and fused, and your fibula, it has also appeared and fused. Okay, fine. So that is again very, very important. That means you see when you are talking about hip joint, I told you hip joint complete fusion, you can say 17 to 18 years. Okay, knee joint Knee joint, again, I told you it is 18 to 19 years. Ankle, right? Though we are not discussing the ankle joint in detail, you just need to know when the joint will become complete, right? Again, it is 17 to 18 years, right? Fine. So again, I'm repeating, humerus, it is 18 to 19, elbow, it is 16 to 17, here it is 18 to 19, wrist joint, it is 18 to 19. When you talk about this lower limb, in the lower limb, the hip and ankle will be 17 to 18, the knee joint alone will be 18 to 19, right? If you stand and if you flex your leg, right, the ankle touching the hip joint, both will be together 17 to 18, and the knee joint alone will be 18 to 19. Okay, so that's how you can remember with this. What are the other ways by which we can find out the age of this person? So we'll discuss about that. First one is skull, right? With regard to ossification, we can find out the age of the person up to 20 years, 25 years. That is a maximum from which we can find out the age of the person from the ossification per se. After 25 years, after that, right, what are the ways by which we can find out the age of the person? Number one, skull, right? Here we'll be discussing on all the parameters of the skull that will help us to find out the age, right? Skull, it has got frontanelles, right, from which we can find out the age of the person in the childhood, right? Skull has also got sutures, which will help us to find out the age of the person, right, after puberty, after maturation, 25 years, 30 years, something like that, right? And in the base of the skull, you also have one more important landmark, which will also help us to find out the age of the person. So there are three aspects that we have to discuss with regard to skull. I told you frontanelles will be helping us, the sutures will be helping us, and the base of the skull will also be giving us one important finding, which will help us to find out the age, right? So we'll discuss one by one. First, let's talk about frontanelle. Frontanelles, right? See, frontanelle, the first frontanelle to fuse is your posterior frontanelle, right? Posterior frontanelle. This posterior frontanelle is also called as lambda. Is also called as lambda, that closes around 3 to 6 months. 3 to 6 months. Then we have one more, that is bregma, right? That is anterior frontanelle. This anterior frontanelle, that is bregma, that closes around, right, 1.5 years, that is 18 months. How to remember? You can see 3 to 6 months, 3 into 6, it is 18. So that is an easy way to remember. 3 into 6, it is 18. Fine. Then sometimes what happens in the skull, let us say this is the skull, right? This is frontal bone, between two frontal bones. After adult, right, we have only one frontal bone. During childhood, during the development, we have two frontal bones. The junction between two frontal bones, the sutures between two frontal bone, this suture will be called as metopic suture. This suture will be called as metopic suture, and this metopic suture, right, that closes around 2 to 4 years. Metopic suture, right, that metopic suture, it closes around 2 to 4 years, right? 2 to 4 years. Fine. Sometimes what happens, that metopic suture might fail to fuse, might not fuse. That is called metopism, right? Might not fuse. That is called metopism, right? That will be unfused. Fine. So do remember 3 points alone: posterior frontanelle, anterior frontanelle, and metopic suture. Now let's talk about the sutures per se. Let's talk about sutures, skull sutures, right? In what way the skull suture help us to find out the age of the person? Before learning about the sutures, I would like you to know two important points. Number one, we have two types of sutures. One is ectocranial suture that you see on the outer aspect of the skull. Similarly, if you see inside, you can see the endocranial suture, right? Endocranial suture. Fine. So this is what you see. This is ectocranial. This is endocranial. There are two types of sutures. Which is more reliable? endocranial aspect suture, endocranial, ectocranial. Which is more reliable? Which is more reliable? See, endocranial suture, it fuses 5 to 10 years earlier than ectocranial suture. The suture which you see on the outer side, ectocranial side, it fused delayed 5 to 10 years later, but the same time, the suture which is on the endocranial aspect, that would have fused 5 to 10 years earlier. Remember, earlier, endocranial. And remember, when you compare both endocranial and ectocranial, the ectocranial suture, right, and endocranial suture, when you compare both, the endocranial suture will be more reliable. Right? Endocranial suture will be more reliable, right? So this is the first point that you have to note. And second important point is with regard to ossification, with regard to dental eruption, what normally happens, the female to teeth eruption will be little earlier. Similarly, the fusion of epiphysis for females, it occurs 1 year earlier. But this is one exception where the females, the suture closure will be delayed. Right? The female suture closure will be later. It will be delayed 1 year later than the males. Right? It occurs later than the males. Right? This is one exception. Normally, for teeth and the ossification, normally in females, the fusion eruption occurs early, but here it is delayed. Okay, fine. Now, the third important point that we have to know is with regard to the different sutures. Let us say we have sagittal suture, we have lambdoid suture, we also have coronal suture. With regard to the reliability, which is more reliable, which is less reliable, which is not reliable, right? With regard to reliability, when you talk about the order of reliability, is first one is sagittal, followed by lambdoid, followed by coronal, right? This is the order of reliability. Right? With regard to the order of reliability, I told you endocranial is reliable than ectocranial. With regard to individual suture, first one is sagittal, followed by lambdoid, followed by coronal. How can you remember? You can remember SSLC. What is that SLC? First S for suture, second S is sagittal, then you have lambdoid, then you have coronal. You can remember SSLC. Okay, so this is the way by which you can easily remember this order of reliability. I've told you the points that you have to remember. Now I'll be discussing about individual sutures. Let us assume, right, you are seeing from top. Okay, you are seeing from top. This is anterior side and this is posterior side. Right, you are seeing from the top like this. You are seeing from the top. Right, when you see from the top, what happens? You can see there is a central sagittal suture. Right? On either side, anteriorly, you have coronal suture, and posteriorly, you have got lambdoid suture. Right? Lambdoid suture. You can say this is coronal, this is sagittal, and this is lambdoid. Okay? You just have to orient yourself with this view. Right? This is anterior, posterior, right? And you are seeing from the top. Sagittal suture, coronal suture, lambdoid suture. For the practical purposes, this sagittal suture can be classified functionally into three, right? 3 parts. This is anterior 1/3, middle 1/3, and posterior 1/3. Anterior, middle, and posterior. Similarly, the coronal suture and the lambdoid suture is divided into 2 parts. The upper half and lower half, right? Upper half and lower half. This is how we have to classify, right? Now you can see again, I'm repeating this. Sagittal suture, you have got anterior 1/3, middle 1/3, posterior 1/3. Coronal is lower half, upper half. Lambdoid is lower half, upper half. Fine? It's very simple. Now let us talk about the age at which it fuses. Fine. You can see the posterior one-third, that is the earliest to fuse, posterior one-third of sagittal, 30 to 40 years. 30 to 40, right? And then you have got 40 to 50 years. Then 50 to 60 years. 30 to 40, you start from the posterior side. 30 to 40, 40 to 50, 50, more than 50. 30 to 40, 40 to 50, more than 50. Fine. This is sagittal. Now coming to lambdoid and coronal. Starts with the coronal. 40 to 50 years. Right. 40 to 50 years. Right. Lower end. Then you have 50 to 60 years. Upper half. Then upper half of lambdoid. 50 to 60 years. And 60 to 70 years. Right? 40, 50, 50, 60, 50, 60, 60, 70. How to remember? You can see this is the skull. You are looking from the lateral aspect. You can see this is coronal and this is lambdoid, right? So now you can see sagittal, it starts 30 to 40, 40 to 50, more than 50. Posterior third, anterior third, middle. Now after this, how you can remember is, this is coronal, start from the low. You start climbing, right? 40 to 50, go up, 50 to 60. Now come down. How will you come down? This is lambdoid. 40 to 50, 50 to 60, 50 to 60, 60 to 70, right? You go up and come down. 40 to 50, 50 to 60, 50 to 60 and 60 to 70, right? So these are the three important sutures that you have to remember for examination purpose. You can remember the three important sutures. I told you the order of reliability, right? Sagittal followed by lambdoid followed by coronal. I also told you in females the suture closes will be little delayed than your males, right? So this is what you need to remember with regard to skull. Fine. I told you about the fontanelle. I told you about the sutures. There is one more important area that I need to show you. First I'll tell you, then I'll show you the base of the skull. In the base of the skull, there is junction between spheno, right? Or you can say sphenoid bone and the occipital bone. Right? Sphenoid bone and the occipital bone. Basically, it is basis sphenoid and basi occiput. Basis sphenoid and basi occiput. The otherwise called as spheno-occipital junction. Right? Spheno-occipital junction. Spheno-occipital junction. This is one very important area. You have a suture over there, spheno-occipital suture, that fuses around 18 to 21 years. This is very, very important, friends. Make a note of this, friends. It has been asked multiple times in examination, be it is NEET or INICET. This is very, very important. Let me show you that point. So you can see this is the base of the skull, right? This is base of the skull. When you look at this point, you can see this is basi occipital region. This is basi occiput. This is basi sphenoid. Basi sphenoid, basi occiput. The junction of this area, this is the junction of basi sphenoid, basi occiput. Spheno-occipital junction. This junction would have been completely, here it is fused. If it is completely fused, you can say the person is above 18 years. You can say the age of fusion is 18 to 21. The age of fusion is 18 to 21. So do remember, this is very important for examination purpose. So I've told you about fontanelle, I've told you about the sutures, I've also told you about the base of the skull, right? So I've told you all the important stuffs. Now we'll be discussing on determination of sex, right? Why sex determination becomes important, right? This is important in not only living beings, it is also important in case of decomposed bodies, in also case of skeletal remains, okay? In many, many circumstances, the sex determination becomes highly, highly crucial for the investigation process. Right, now we'll discuss how to determine the sex of a person. Number one, we can just look at the physical examination. When you physically examine the person based on the primary sexual characters, based on the secondary sexual characters, you can identify the sex of the person. Right? Fine. The next important thing is nuclear sex, also called as chromatin sex. We'll discuss about that. Here, we'll be learning about two important bodies. Number one, Barr body. Number two, Davidson body. Let's look at this Barr body and Davidson body. Barr body is basically inactivated X chromosome. Inactivated X chromosome, that is Barr body. When you look at the Bohr body, how does it appear? It appears inside the nucleus as a condensed mass like this. Okay, condensed mass. Whereas Davidson body, this is actually a cellular appendage. This is a cellular appendage which is seen in the leukocytes, basically neutrophils, right? You can say polymorphonuclear leukocytes. And you can see this is your neutrophil. Inside the neutrophil, you will have a lot of lobes. Multiple lobes will be there. This Davidson body is seen as a drumstick-like appearance attached to one of the lobe. Okay, this is seen as a drumstick-like appearance in one of the lobes of neutrophils. That is Davidson body. In which cell that you can see this Bohr body and Davidson body? The Bohr body can be seen in all somatic cells. In all somatic cells, you can see this Bohr body. Whereas Davidson body, just now I was telling you, it is seen in the neutrophils. It is seen in the neutrophils, particularly in females, right? So that is Davidson body. Fine. Where should you take smear from? If it is Bohr body, I told you it can be seen in all somatic cells. The ideal sample that we normally collect is buccal smear. We take it from the buccal smear. Sometimes we can also use hair follicle. We can use buccal smear. We can also use hair follicle. Okay, right? If it is Davidson body, right, you can just take the blood smear because it is present in the neutrophils. You need to take blood smear for this. Okay, let us look at the Bohr bodies. Right, Bohr bodies, we just see how it is appearance in different conditions. Okay, let us say the person is a normal male. Normal male, phenotype is male, chromosome is XY. The number of Bohr bodies that can be seen in the cell can be identified by n-1. Okay, number of X chromosome -1. Here you have only one X chromosome, right? 1 minus 1 is 0. You don't have any Bohr body in male, right? Okay, now looking at normal female. Normal female, it is XX. So the number of Bohr body will be 1. Okay, n-1. Fine. Then you have Turner syndrome. It is the phenotype is female. And if you look at the chromosome is X0, where again you will see 0 Bohr bodies. You will not have any Bohr bodies. The next syndrome is Klinefelter syndrome. The Klinefelter syndrome, you know very well, the phenotype is male, wherein you can see XXY. Okay, XXY. So the number of Bohr body that you can see here is 1, n-1. Okay, fine. Now the next syndrome is your XXX syndrome. You can see the phenotype is female. You will see XXX. So the number of Bohr body will be 2. Since there are 3 X chromosomes, you need to minus is subtracted by 1. So you will get n-1, right? 3 minus 1 is 2. You will get 2 Bohr bodies. So this is the number of Bohr bodies that you can see in different conditions. Okay, that is Turner syndrome, Klinefelter syndrome, Fragile X syndrome. So all these things you can find out from this. Okay, right? I told you about physical examination. I told you about the nucleus sex. You can also find out the person based on the gonadal sex of the person, right? Depending on the gonads, whichever gonads is available, right? If it is testis, it's male. If it is ovary, that is female. Based on the gonads, you can identify the person. Gene-based sex. Gene-based test can also be done to determine the sex of the person. There is one important gene that you can see here, that is SRY. SRY. Okay, so that is important gene that is present in the Y chromosome, right? So which will help us to find out the gender of the person. Okay, SRY. There is one more gene that is there that you can normally see in the somatic cells, DYZ1. Right, DYZ1, that is also normally present in somatic cells of a male. Fine. So these are the 2 important genes based on which you can find out the gender of the person. Then concealed sex. What is that concealed sex? They are the individual who hide their real sex by cross-dressing. They conceal the sex by cross-dressing with a motive. Right? Any motive. What we have to do in case of concealed sex, you don't have to do anything, right? Just undress them. Physical examination, that should be sufficient enough to identify the real gender of the person. Okay. Now we'll be moving on to another important area, examination of skeletal remains. Okay, that is sex determination from the bones. That is one important point about skeletal remains examination, right? Fine. Now we'll discuss about, see here, what we have to do is, we'll be discussing about the sex determination in case of skull, the mandible, the pelvis, right? So these are the three important bones that you get normally questions on in different examinations. Okay, so we'll be discussing about these three bones in detail. Okay, but what we have to understand is the sex differentiation, sexual dimorphism in bone, that means sexual characters of male and female, is normally seen after puberty, only after skeletal maturation. You can say around 14 to 16 years. Before that, you don't normally see the male female sexual characters. There is one exception. We'll be discussing about the exception later. Okay, for now you remember, generally the sexual dimorphism, the sexual differentiation, is seen only after puberty, that is 14 to 16 years. Okay, right. So as I told you, we'll be discussing about skull, we'll be discussing about pelvis, we'll also be discussing about mandible. These are the three important bones that we get in the examination. Okay, let's start with skull. Right, let's start with skull. Fine. So all the, in general, all the muscle markings, all the ridges, all the muscle marking, all the ridges will be more prominent in case of males. It will be less prominent in case of females. Right, more prominent in males, less prominent in females. Okay, so this is general rule. And the male bones will be heavier, female will be lighter. Okay, all the ridges, grooves, prominences like supraorbital ridge, glabella, occipital protuberance, mastoid process, frontonasal angle, right, digastric groove, everything will be more prominent in males. It will be less prominent in females. More prominent in males, less prominent in females. Okay, you can see all the ridges and grooves will be more prominent in males, less prominent in females. There is one exception that we have to learn here, that is highly important for examination purpose. All the prominence are more markedly seen in males, less markedly females, except to number one, frontal eminence. Number one, frontal eminence. Number two, it is parietal eminence. Right? These are the two eminences which are markedly seen among females. Right? This point can be asked in the examination. This has already been asked multiple times in the examination. So they can ask you like this: which of the following, all the following characters are of male bone except, right? Prominent frontal eminence, prominent parietal eminence is not a feature of male bone. That is a feature of female bone. Okay, so that we have to understand. Right? This is one important point that we have to understand for examination purpose. Then what about forehead? In case of male, the forehead is slopy, whereas in case of female, the forehead is vertical. It is slopy in case of a male, whereas it is vertical in case of female. Okay. What about the orbit? Look at the orbit. If you look at the orbit shape, in case of male, it is square, approximately. Right? In females, it is round. Males it is square, female it is round. Okay, so these are the main differences that you can see from the skull. Okay, you can easily find out this particular point based on which many of the questions can be asked. You can see this is the skull. Fine. You can see this is forehead, the one which is seen on your left. So this is male, this is female. Okay, you can see glabella. I told you more prominent in male, less prominent in female. Right? You can see the supraorbital ridge. Right? So this is shape of the orbit. Fine. Let's talk about mandible. When we talk about mandible, you can see that the mandible angle, right? You look at the mandibular angle. You see this is your mandibular angle. Right? Fine. You can see it is less obtuse in case of males. Right? It is more obtuse in case of females. Right? Basically, you can remember 120 degree. Okay. If it is less than 120 degree, that is male. If it is more than 120 degree, that is female. Right? Less obtuse, more obtuse. more obtuse. Ascending ramus. Ascending ramus is of greater breadth. You can see wider one in case of male mandible. Whereas it is not so, it is smaller breadth in case of female mandible. Smaller, it's not so broad. Okay. Mental tubercle. Mental tubercle is prominent. Right? It is not so in case of female. Look at the height of the mandible. The height of the mandible will be maximum at the symphysis, this area. Only in the symphysis it is of maximum height. It is not so in case of females. Not so in case of females. Right? Chin. When you look at the chin, you can see the chin, right? The male chin will be something like this, whereas the female chin will be something like this. It is square. It is square in case of male, right? You can see it is V-shaped in case of female mandible, right? Female mandible. You can see this is square. Male, it is V-shaped in case of female mandible. Okay, female mandible. Okay, so these are the different characters of female and male mandible. Now we'll be moving on to one more important bone. This is the most important bone with regard to all the bones available. I'll tell you why. Let's talk about pelvis. Pelvis, we have male, female characters. We'll discuss one by one. First thing is, see, there are a few important characters that you can remember by looking at the childbirth feature. See, the female pelvis is structured in such a way that it will facilitate child labor. Okay, the female pelvis is designed in such a way that it will facilitate child labor. There are few characters you can think about that and you can remember. Number one, pelvic inlet. You look at the pelvic inlet is heart-shaped in case of male pelvis. Whereas the female pelvis, it is not heart-shaped, it is circular or oval. Okay, this is inlet. Now coming to the cavity. Look at the cavity. In case of male pelvis, the side walls are exactly converging. The side walls of the pelvis, male pelvis converging. So basically it looks like a funnel. Whereas in case of female, the side walls are vertical. It's not converging, it is vertical. You can see a bowl shape, flat bowl shape. Right? That is for the baby to come down easily. Then in the outlet, there are a few characters we have to discuss. Anteriorly, we have what is called a subpubic angle. The subpubic angle, you can see it is less acute. You can see it is 70 to 75 degree in case of male. It is more than 90 degree in case of female. It has to be so broad so the head of the fetus can come out easily. Okay, the subpubic angle, it is more than 90 degree. This is again one of the very important point to be remembered. Okay, now the next thing is posteriorly we have ischial tuberosity. The ischial tuberosity in case of male, it is inverted. Whereas in case of female, it is everted. In case of males, it is inverted. In case of females, it is everted. Right? It has to be everted so that the head of the fetus does not face any obstruction. Okay, so all these features, the four features are basically about the childbirth. You can remember the childbirth in a female pelvis and you can remember everything. The inlet, the cavity and the outlet. Inlet, cavity and the outlet. Now talking about the other features in the pelvis. So let us look at the other features. Let's look at the body of pubis. Let's look at the body of pubis. When you look at the body of pubis, the shape of the body of pubis, in case of male, it is triangular. Whereas in case of female, it is like a square. It's like a square. Okay. And then we have to see the preauricular sulcus. This is one important point that you have to remember for the examination. See this preauricular sulcus, sulcus that is just anterior to the auricular surface. In males, you do remember, in males, it is narrow, superficial. It is not deeper, not so prominent. Whereas in case of female, it is so wide, it is so deeper, and it is so prominent, particularly for a female who has given delivery, was undergone parturition. Right? Because, so this sulcus is giving attachment to the sacroiliac ligament. where during parturition this ligament is so stretched, the sulcus become more prominent. For other females, it will be exactly looking like a female's only, male auricular sulcus only. For a female who has given delivery, this sulcus becomes more prominent. Okay, more prominent. Fine. So the next feature is obturata foramen. Obturata foramen in case of males, it is oval. In case of females, it is triangular. It is triangular, a little larger also. You can say it is triangular in case of female, right? And the last one is sciatic notch. Sciatic notch, right? We can see the greater sciatic notch. Greater sciatic notch. This is the most important criteria. Most important criteria. In case of males, the greater sciatic notch, it is deep and narrow. Whereas in females, it is wide and shallow. Right? So this is one of the most important criteria. In males, it is like this, it is deep and narrow. In females, it is like this is wide and shallow. Okay? So that's an easy way to remember. You can see of all the criteria that you see in the pelvis, the best criteria is your greater sciatic notch. Right? You can remember this is the best criteria, right, of all the criteria that you see in the pelvis. The greater sciatic notch. Okay, greater sciatic. How can you remember these features? I told you there are certain features for the childbirth. You can remember inlet, cavity, outlet. In the outlet, you can see subpubic angle and ischial tuberosity. The other features you can remember by remembering the mnemonic BOSS. What is that BOSS? B for body of pubis, obturata foramen, sulcus, that is preauricular sulcus, and greater sciatic notch. Okay, you can remember this, and you can remember the 4 important landmarks that you have to remember for sex differentiation pelvis. Okay, now you can see that I've told you about skull, I've told you about pelvis, I've also told you about mandible. The next thing is we need to learn about sacrum. Let's talk about sacrum. When you talk about sacrum, you can see that in case of males, it is longer, narrower. Whereas in case of females, it is short and wide. Short and wide. Short but wide. Right? Then you see the promontory. The sacral promontory is so prominent in males. More prominent. And that is the reason why you can see the shape of the pelvic inlet. It's more like a heart shaped in males. Why the pelvic inlet is heart shaped in males? You can see the sacral promontory is more prominent in male, that it comes forward and makes it heart shaped. Okay, and you can see the females, it is not prominent, and that is the reason why it is circular in case of females. Okay, sacral promontory. You look at the curve of the sacrum. You can see it is uniformly curved in case of males. Right? In females, it is not uniformly curved. It is vertical, then it comes forward. It's not uniformly curved. Not uniformly curved in case of females. The upper segment is vertical, the lower segment is coming forward, right? Anteriorly, it is projected forward. Fine. Now, articulation. The articulation of male sacrum, it can go up to 2.5 to 3 vertebra. Right? Whereas in case of females, the articulation, it will be 2 to 2.5 vertebra. Right? It is little longer in case of males, it is little shorter in case of females. That's all you need to remember. Okay. You can see that this is your male and female pelvis. Right? You can see this is male and this is female. Right? You can see sacral promontory is more prominent, it is less prominent. You can see the sacrum is longer and narrower in case of male. You can see that longer, narrower in case of male. It is shorter, wider in case of females. Okay? Right? And you can see this obturata foramen, it is oval in case of males, it is triangle in case of females. right? You can also see the most important point that you can see here, that is subpubic arch. You can see this is, right, less obtuse in case of males. It is more obtuse in case of females. Or you can see less than 90 degree in males, more than 90 degree in females, right? So we'll be looking at all the features. You'll see this is your sacrum, right? This is male and this is females. Okay, the sacral promontory is more prominent, and you can see this is uniformly curved. This is short, right? Short, and you can see it's wide. Okay, right. You can see the two skulls, one belongs to male, one belongs to female. Okay, so this is larger, heavier, rugged. This is smaller, lighter, and it is smoother. Okay, you can see this is male skull. This fellow is male. You can see this is glabella, more prominent, supraorbital ridge, more prominent. You can see the frontonasal angle, okay, distinct, right, very distinct. And you can see the mastoid process, which is larger and rugged. You can see this is external occipital protuberance. This is also more prominent. Okay, and similarly, you also need to look at this female skull. You also have to look at the female skull, right? You also have to look at the female skull. You can see this is lighter, as I told you. There are two important areas that we have to see here. Number one, frontal eminence. Number two, parietal eminence. Frontal and parietal, more prominent. And look at the typical forehead, the vertical forehead in case of female skull. Okay, vertical. This is so very important. So very important. Now look at the mandible. You can see these are the two important mandibles, right? The one, this fellow is male and this fellow is female, right? You can see the angle, compare the angle, right? You can see, compare the angle. This is more obtuse in case of female. This is less obtuse in case of male, right? You can see, compare the angle. And you can also look at this chin, right? Male, you can see this is square, more or less square. Okay, so in case of female, it is not so, it is V-shape. It is V-shape. And you can also look at this ascending ramus. You look at the ascending ramus, is of greater breadth. It's so wide. It is so wide, and the height is more at the symphyseal area only. Height is more at the symphyseal area. So these are the features I told you for sex differentiation of mandible, right? And the next and most important bone that comes here is the pelvis, right? This pelvis. You can see this is a pelvis, larger, rugged. You can see subpubic angle. This subpubic angle, I don't think it is more than 90. It should be less than 90. So it's basically a male pelvis, right? You can see this is a greater sciatic notch. The greater sciatic notch. You can see the greater sciatic notch. It is deep and narrow, right? It is deep and narrow. Fine. And look at this inlet. What is so prominently seen? The sacral promontory, that is so prominently seen, it comes forward. It comes forward. Okay, right? So this is quite very important. And you can also look at this sacrum. Sacrum, it is uniformly curved. Uniformly curved. Now look at the female pelvis. If you look at the female pelvis, you can see the first important thing that you can notice is the subpubic angle. It is so wider. Okay, right? I told you the reason. You can see the inlet, the promontory is not so prominent. And also look at the sacrum. Sacrum is shorter, broader, shorter and broader. The most important landmark, that is your greatest sciatic notch. The greatest sciatic notch is wide and shallow. It's wide and shallow, right? This is the most important landmark that you have to remember. And obviously the acetabulum will be smaller in case of female, that will be larger in case of males, right? You can see this is the male pelvis and this is the female pelvis. Look at the subpubic angle, which is so prominently visible, right? So this is males, this is male and this is female. Okay, you can see the sacrum. The sacrum, I told you, the first sacral vertebra, the body of first sacral vertebra, which is so prominent, and you can see this is so broader. The breadth is more. Here we have one important index. What is that? We call this as corporobasal index. Corporobasal index. This is so important. Many times you got this in the examination. This corporobasal index is basically the ratio between the breadth of S1, that is sacral, first sacral vertebra, divided by the breadth of whole sacrum. Breadth of whole sacrum itself. What is that whole sacrum? The sacrum, when I mean, that includes both the ala as well. Okay, S1 is only the body. Sacrum, the whole sacrum means the hela, whole hela, into 100. This is one important index. This is one important index where you can see males, it is 45. Whereas in females, it is 40.5. Right? Males, it is 45. Females, it is 40.5. Right? So this is corporobasal index. Do remember, this is breadth of S1 divided by the breadth of whole sacrum. This ratio itself was asked in one of your examination. Right? AIIMS examination, that you have to remember. This is from the sacrum. Now look at the other bone. Right? That is sternum. Sternum. We have one important rule that is called Ashley's rule. Ashley's rule of 149. What is that Ashley's rule of 149? Right? You need to measure the length of the sternum. Right? This is about sternum bone, right? So we have to measure the length of the sternum, right? The length of the body and the length of the manubrium together. Manubrium and the body together, right? If the sternal length, that includes body and manubrium together, right? If the sternal length is more than 149 millimeter, it is suggestive of male sternum, right? The length is more. If it is less than 149 millimeter, it is suggestive of female, right? Here we are including both the manubrium and the body together. It's very simple. You just have to remember only one thing, that is 149. Right? If it is more than 149 millimeter male, it is less than 149, that is female. This is called Ashley's rule of 149. Right? So easy to find out. Let us look at one more rule. Hurdle's rule. What is this? Here you can see the sternum and you can see the body and you can also see the manubrium, right? If suppose the body is longer than twice the length of manubrium. Let us say if the manubrium is 40 centimeter. Manubrium is 40 centimeter, right? And the body is 100 centimeters, right? You can say if you make it twice, 40 becomes 80. Still it is less than 100, right? If it is twice the length of manubrium, body is longer than twice the length of manubrium, it is suggestive of male. Similarly, in case of female, body is less than twice the length of manubrium, right? Manubrium will be longer, body will be little shorter. Fine, little shorter. Fine. So this is called Hurdle's rule that you have to remember. Body is longer than twice the length of manubrium. Body is less than twice the length of manubrium. So that is in female. Okay. So these are the two important rules that you have to remember with regard to sternum. Okay. Now let us look at the different indices that we can find out from this. What are the different indices? The first one is Shattuck index that you can use for, we are talking about the indices for sex determination. Sex determination. Right? Number one, Shattuck index, sternal index, right? Sacral index, ischiopubic index. Ischiopubic index is also called as Washburn index. Washburn. We also have corporobasal index. Right? All these indices are meant for sex differentiation. And do remember, all these indices will be more in case of female, it is less in case of male. It is more in case of females, it is less, the value is less in case of males. There is only one exception, I told you earlier, only one exception, that is corporobasal index. This is the only index which is more in case of males. They can ask you something like this: which of the following index is more in case of male? They can give you sacral, sciatic, ischiopubic and corporobasal index. You need to remember it is corporobasal index. Corporobasal index. This is one index which is more in case of male. right? 45 in males, 40.5 in females. Remaining indices are more in case of females only, right? So you need to remember what are the indices that are used for sex determination of bones. I will give you a mnemonic also for you. You can remember sleepy, Sarah slept in class, right? You can remember sleepy Sarah slept in the class, static index, sternal index, right? Sacral index, ischiopubic index, and corporobasal index. You can remember this mnemonic. You will remember all the important indices meant for sex determination. There is one more indices also there, that is kylotic line index, right? To remember, there is kylotic line index that is also meant for sex differentiation only, but that is not so important. You just remember these are the most important indices meant for your examination purposes. Okay, right? So let's talk about the accuracy of sex determination from each bone. I told you the pelvis, in the pelvis, the most important criteria in case of pelvis is greater sciatic notch, and that is the same reason why if you talk about all these indices, the best index will be sciatic index. Okay, sciatic index. Now moving forward, let us say that you have pelvis, right? That will give you 95% accuracy in sex determination, right? 95% of the times will be able to find out the sex of the person, right? Talk about skull. This is 90%. Okay. Long bones, it is 80%. And among the long bones, the best long bone for sex differentiation is female, right? Even though the accuracy is less when compared to other bones, long bones, among the long bones, femur is best. Suppose if you see pelvis is 95%, skull is 90%, long bone is 80%, which is a single best bone for sex differentiation? The single best bone for sex differentiation is your pelvis, right? Pelvis, right? There is one more important reason why you say pelvis is best, because I told you that most of the bones, the sex differentiation features can be identified only after puberty, that is after 16 years, 14 to 16 years. But this is one bone, even in children, even in fetus also, you will be able to find out the sex of the person by looking at the pelvis. That is why this is best bone for sex differentiation. Even in children, this will help us to find out the sex of the people, right? Fine. Even in fetus age also, because I told you earlier, the pelvis is structured in such a way that female pelvis is structured in such a way that it will facilitate child labor. Okay, that is in the developmental stage itself. So you can find out the sex differentiation, right? Even in the fetus age itself, even in the children itself, just like not like other bones where you need to wait till puberty for sex differentiation. Suppose, see, the highest accuracy from single bone is 95. Suppose if you want to increase accuracy, you can combine two bones, pelvis with skull, it is 98%. Sometimes you can also combine pelvis with long bones. In this case also you get 98%. When will you get 100%? When you get complete skeleton, the whole skeleton, it is 100%. To remember, this is called Krogman's accuracy. This is one important accuracy that you have to remember. This is called Krogman's accuracy. Krogman's accuracy. Basically, it is the accuracy of bone for sex determination, right? Accuracy of bones in sex determination. It given by Krogman. That's why it's called Krogman's accuracy. Okay, I told you which is the best bone, and you will get 100% only when you get complete skeleton. Okay, right.